Okay, we are at time, so I'm going to go ahead and get started. Good morning, everyone. This is the revised MnCHOICES application launch webinar for Wednesday, September the 13th, 2023. Please know the PowerPoint for this webinar will be available in the DSD archive. It is currently not available. We were making changes on it until yesterday. So check next week for the DSD archive page for a copy of this PowerPoint, and if you want to review the recording. These are the members of the team who are with me today. Please remember this session is being recorded. We are using WebEx audio to listen to the session, and all you are currently muted. All our participants are muted. When it's time to ask questions, we'll ask you to raise your hand. We will call on you in the order that you raise your hand. When we call on you, we will unmute you and you will be able to ask a question. For this call, I'm going to really hold you to one question. We have had lots of folks asking more than one question at a time. And then that means we're not getting to other folks. So please ask only one question, and then you can raise your hand again and get put back in the queue. But we want to make sure we get to all of the questions that people have today. So one question at a time, please. So these are our acknowledgement and ground rules. We went over them a bunch. Basically, what's most important to remember is that we're really fostering an atmosphere of good intentions and respect. We are here to provide you information and support you, and you are here to ask questions, and so that we can make sure that you have what you need for your agency for launch. So here's today's agenda. We're going to go through some reminders, then we're going to talk a little bit about the August release. We're going to go through any additions to the current functionality document so that you're aware of them. We're going to spend some time giving you some kind of tips for resolving issues when you have user experiences, and then any resource information as well. So let's go through our reminders. So as you all know, we set up office hours calls to be once a month, the first Friday of the month through June 2024, to make sure that you have a call every month to ask questions as you go through this launch. Our launch webinar today is the last launch webinar of this session of launch webinars. All other sessions that we may have may be added. If we can hear agencies are commonly having issues, then we may add an additional call-in session. But currently office hours will be your support for launch going forward. The MCOs have requested, as they are new agencies into MnCHOICES, they have requested call-in sessions, so we have some scheduled for them. And really the goal of them is just to answer questions about MnCHOICES and MCO workflow in MnCHOICES. It can include both delegates and the MCO agencies. So with that, I'm going to allow for questions that are about either that we've just started or about with what I've provided for information. Please don't ask any other questions. So if you've raised your hand and you have another question in mind, can you lower it? And then you can return to it after we move into the August release items. So are there questions, Beth? Do people have questions they need to ask about my reminders?
Nope, everything looks great. Thanks.
We will keep going.
No questions.
So we're going to take a moment and go through the August releases. This is a brief explanation of the release of the items that were fixed in the last release, in the August release. Releases happen at the last Friday of the month at 4:30. And so we'll go through them. So fixed in the August release, before the release, there were a limited number of records getting in MnCHOICES assessment LTC status of unknown, when they should be getting eligible for MA LTC, and that issue has been resolved with the release. The second one is the HELPS injury helps brain injury screening document section P wasn't displaying scores correctly, and after the release, the P section now is displaying correctly. And lastly, the area of needs in the support plan HRA when modifications assistive technology and remote support, when you selected them, the text is and enter the text in the field, the area of need didn't display correctly. So now the area of need will not display. It was displaying and it shouldn't in the support plan HRA when modifications assistive technology and remote support is selected and when text is entered in the field. So it was displaying when it shouldn't, and now it will display when it should only. So we're going to go through some other release items that also occurred. I love these moths. I was seeing them the other day. They're like a hummingbird moth. They're fun to see. So some users were reporting that they were unable to sync or check in offline forms. This has been resolved for those specific users. I have to make sure. Sorry, that threw me off. It did start at 2:09. Lead agency supervisors were unable to reopen a MnCHOICES assessment, and we fixed that as well. So now a lead agency supervisor can, when an assessment is approved in MMIS, so that specific status, because that means that assessment is closed, they can then go in and reopen, go to the status and choose reopen. Otherwise, they have the ability to go back and do request clarification to move an assessment back to in progress. The staff person does themselves. So you're hearing me being fussy about this language when it's approved in MMIS, when that's the assessment status, that's when reopen is available for lead agency supervisors. CFSS to PCA worksheet. A section of the form wasn't accepting edits, and the home rules section is populating the results of the entry of the home care rating and number of ADLs, and so those have been fixed. Service definitions. There were several service definition updates. First, customized living service provider codes were corrected so that you could choose the enrolled provider in the support plan. For MCHO and MC Plus home care services, elderly waiver and disability waivers, users are now able to choose enrolled providers in the support plan. For PCA, registered nurse supervision services are now available also in the support plan with a CFSS only program type. So that's also available. And then there were some changes to specified DHS roles to allow for a more streamlined approach to working with you. So resend verification emails are now available to the DHS help, the DHS security role, so that group of people can go ahead and resend those verifications. Prior to that, we were having to go to FEI's help desk to ask for those to be resent. And then lastly, we're now able to print HRAs and review them. So that's a benefit to working with you and solving some of the issues that you report. So let's talk a little bit about the new additions. Please note that we changed the naming of the current functionality document. It is now going to show the version of the last release. So the last release was 8/2023, so that's going to be the version history. And even when it goes to January 2024, it'll be version 1/2024. So it should be easy to see when the document was updated through the last release. So let's talk through the new additions. So Amy, do you want to take this one? I see I have you as presenter.
Hi, Teresa. Yes, I can take this one. Hi, everyone. This is Amy Alexander. So the one that Teresa has up right now was an issue where the MnCHOICES assessment narratives we're not copying over correctly. So in a MnCHOICES assessment, when you're creating a new assessment and you select yes to have the information copied over, there are a couple areas, so it's personal cares and household management, where the information that's being copied from the previous assessment isn't coming from the correct area. So I think in both scenarios, it's coming from the housing. The housing narrative is being placed in the personal cares and household management. So until it's fixed, when you do copy from the previous assessment, you'll want to review the personal cares and household management narrative boxes, and then you'll have to, if you want that text to come over from the last assessment, you'll have to go in and copy it and paste it into the new assessment.
Thank you, Amy.
Yeah, you're welcome.
So the next one is about users with the same location and the same role. So if you work in the same location and you're a certified assessor, you're able to edit the MnCHOICES assessment at the same time. And so our directions, of course, are going to be, the system's not going to stop that from happening for users who aren't assigned to a person. So people just need to really make sure that they're not editing other people's work. Instead, they need to just send a message to the user to note any possible additions or changes to ensure that they don't interrupt the person who is actually responsible for working in the MnCHOICES assessment. So Beth, I will give you this next one.
Sure. This one is about the DD screening document. The self-care field. So self-care, as you all know, it's dressing, grooming, bathing, and toileting, and eating. Sorry if I missed that. But those 5 fields merge into one in the DD screening document. And when a person needs assistance, this is only when a person needs assistance, physical assistance in toileting. So if a person needs physical assistance in toileting, but doesn't need that level of that physical assistance in any of the other areas for self-care, the self-care score is incorrect. So it'll score an 03 versus an 04 on the DD screening documents for self-care. If the person needs physical assistance in any other field, and including toileting, you can disregard this. It's not anything that you'll need to pay attention to. It's just that one circumstance where they're pretty independent in the other self-care areas, but they need physical assistance in toileting that you'll need to monitor for. So you can read through this just to say we've provided the exact answers for within the assessment that would score an 01, 02, or 03 for the other self-care areas.
And then the instructions are what, please?
Oh, you're just manually making the change on the screening document to an 04 when someone needs physical assistance in toileting, but does not have needs in the other self-care areas.
Thank you, Beth.
Thank you.
So the next one is about assistive technology. So the current service with the HCPC score that you can see here needs to have an end date as of June 30th, 2024. So the users will use the old service in MnCHOICES and enter the new service in MMIS because the HCPC is updated in MMIS but not in MnCHOICES. So users will use the old service in MnCHOICES and enter the new service in MMIS, and this will make the support plan out of sync with MMIS, but it ensures the service is authorized correctly. So I'm going to take a minute and let me go see where we're at for the number of slides before questions can get asked. I think let's take a moment. I didn't insert a question slide here and probably should have to make sure people don't have questions about these specific items. What we're gonna do next is talk through resolving user issues. There are about 13 slides, and then we can take a break and ask questions again. And so are there any questions about the items that we went over?
Yep, our first question is from Madonna. Hi, Madonna.
Good morning, Teresa.
Morning.
Could you go back to slide 18?
Of course. Let me
Thank
just
you.
get there. Sorry, I was hoping I could just not have to do this, but I have to. So please, there you go.
Okay. So the service definition codes for the customized living service provider codes, are you referring to the HCPC codes or are you referring to their NPI numbers? Or am I just missing that totally?
You know, can someone else answer that question for me? Because
Yep. This is Amy. Can you hear me?
barely. A little louder, please.
Yeah.
Okay. So the customized living service provider codes are what we use in terms of like what they have on their provider record. And so I know with customized living, what's happening is some of the providers do not have the code for customized living for 65 and older. And I was asking about this, and it sounds like before MMIS was allowing people to authorize 65 plus customized living, even when the provider didn't have the correct codes. So we're seeing a lot of that now. And so what's going to happen is the provider is going to have to go back to talk to the provider support folks and get that 65 plus added onto their record.
Okay. So if they don't have that provider code, is that going to impair the ability to create a customized living tool in the support plan?
You're not going to be able to get a rate without a correct provider.
Okay, because I submitted a help desk ticket yesterday.
Yep.
Because we had the MPI for the assisted living facility. We're trying to create a 24-hour customized living. We conducted an advanced search for supports, and we put in the HCPC code, a modifier, and we could not find the service. Nothing populated.
Okay, yeah, and I'm the one that's gonna be responding to that ticket. So I did see it this morning, and so I can shoot that back to you specifically.
Okay, but is that the reason why it won't populate? Is because this assisted living doesn't have the provider code necessarily to provide the 24-hour customized living, or am I off base there?
So there can be two separate issues. We've had some people where they just don't have customized living at all on there, and so you'll get an error that'll say this provider is not eligible to provide this service. And unfortunately, you get that sometimes at the very end after you've put everything in. And then there's providers that like you can pick them, but they don't have the correct provider code to provide CL for people over 65. So that's an issue that the provider has to pick. So if you can't find the provider at all in there, that means that we need to add them in to the system.
Yeah, well, we found them. It's just we went in and we put in the HCPC codes and did the search, and there was no options populated for that service, the 24-hour customized living.
Oh, so what?
So we're at a standstill.
So you should, regardless of what provider you have in there, you should still see the service. And I would suggest searching by just start with 24, and then it'll usually come up with 24-hour customized living and then a couple other services.
Okay, what code did you say?
Well, if you just search by it, instead of searching by HCPC, when it says search in the search bar, you can just put 24.
We did that as well, and nothing populated.
So that's strange.
Okay, so it sounds like this is one that
Yeah.
Amy's gonna have to go look at the help desk ticket and then get back to you on, Madonna.
Yep.
Okay, thank you.
Yep, thank you.
Madonna, the PCARN supervision is about HCPCS though, specifically.
Oh, okay, thank you.
Yep, thanks. Okay, the next question is from Carrie Arndt. Hi, Carrie.
Verify the same conversation that you were just having to make sure we're using the correct terminology. It's the specialty codes that the providers do not have listed. And who are we supposed to? It sounds like counties are needing to reach out to these providers to let them know that they don't have these codes.
That's correct. Yep, they have to call our provider support folks and let them know that they need those 65 and over provider specialty codes.
And what about under 65? Because it's affecting both.
Yeah, now I haven't seen.
Like we have a provider that, and I just sent a ticket in and someone responded. But we have providers, a couple of them that don't have any customized living codes in there for under or over 65. And when I've tried talking to the providers, they don't have a clue what we're talking about because we're currently able to put in an authorization in MMIS and it's been fine for straight EW clients. So I feel like we just don't know how to inform them. And we're running into this issue once we're in the system trying to develop a rate and now we can't get a rate.
Right.
And now we're just having major setbacks.
Yeah. So I need to test this theory, but I think that you can not put a provider in there and you can actually fill out the tool. You still won't get a rate, but then as soon as you get the provider in there, just if you want to do some pre-work, but that provider, I think what you need to tell that provider, or what whoever's talking to them needs to tell them that, we've got a new system and it's doing double checking and they won't get paid if they don't, if they don't call and fix that. Because right now we can't authorize it through MnCHOICES. So especially for fee for service, we have to have the rate, in MnCHOICES in order for us to do a service agreement. So they're going to have to call provider, talk to them about getting those on their record. If they don't have any customized living on their record, that's really surprising because I know that it's not been as picky about the 24-hour or the regular CL, but if they don't have it on there at all, then that's a bigger issue. So, but that's something, unfortunately, we're gonna have to count on the providers to do. There's a new sheriff in town. They want to make sure all the codes are right. So,
but I just think the question that I have is why is it now an issue when it hasn't been in any other authorization system we've been using? That's what's hard for them to understand. That's what I don't know how to explain it to them. And I don't know exactly who we're supposed to reach out to at each facility.
I would say that the billing department or somebody, whoever is in charge of making sure, whoever is in charge of making sure that they're current, all of their paperwork and everything is current with DHS. They're the ones that would need to call the provider helpline and say that they need specialty codes. And they may not understand what that is, but when they're talking to provider support, they will. So.
Okay, thank you.
Yep.
Next question, please.
Okay, Sarah Hickman. Hi, Sarah.
Oh, hi there. Kind of piggybacking on this previous question, I just want to make sure I understood what you guys just said about lead agency's responsibility. So I was taking notes, and if the provider doesn't have this specialty code for customized living, we are, as the lead agencies, responsible to alert them to this. And then lastly, it says we're supposed to tell the provider that we have a new system and that they need to call DHS provider helpline to get the customized living specialty codes. Did I capture that correctly?
Yep, that is correct. And if,
Okay. And are we supposed to, should, see, this is why it's very complicated, because we're not doing a lot on the assessment side of things with these providers. So one thing that I think would help us is to get some type of template with the verbiage that we need to use. So we can all maybe be a little uniform in our guidance to them to make sure it's correct. I think that would help me. Because there's just so many customized living places, and I just fear it's going to take a lot of time.
So you're aware, I have a note down for after our webinar today to have discussion about this item.
Oh, thank you so much, guys. Okay.
Yep, just so you're aware.
Okay, our next question comes from Kelsey Peters.
Hey guys, sorry, I know it's the same topic, but I guess I'm just confused as to why, if the providers have the specialty codes in MMIS, how come it didn't migrate into MnCHOICES revision?
I think that's the issue, is that the new system, the revision is looks at that more deeply than MMIS did. Does.
Monitors it more closely, you mean?
Yes.
Beth?
correct.
Okay.
Yeah, and so it's looking for those specialty codes.
Okay, so the MnCHOICES revision system monitors those specialty codes and eligibility for them more closely than MMIS does. So we can't, okay.
Right.
This is Amy, and I just wanted to add on there that it might not be a problem of did it migrate. It's that they didn't have the specialty codes to begin with.
But how could we have authorized services for them, like currently, if they weren't already approved for the service code?
Because the MMIS was allowing people who had only the, like for instance, only the under 65 customized living specialty codes to authorize over 65. So that's what we're saying, that it's more, it's looking at things more deeply to make sure that they have the correct specialty codes, which MMIS was letting go by before. So.
Gotcha. I think there's been some instances too, though, that we've seen providers, like they populate several specialty codes that we don't believe they actually offer, like for services. So it's almost like they're over, like the system has, you know, it's showing that they're able to offer like IHS with training or like other services that they don't actually offer. So I've kind of seen it the other way too.
Yeah, it's possible that if they ever provided that service, that they never ended that service on their record. So.
Got it. Okay. Thank you for that clarification. I appreciate that.
Yep.
Okay, Madonna, you are back up in the queue.
So Amy, I have one more question regarding this customized living. Is when I call this assisted living today, and I have to let them know that they need to, call DHS or whoever they have to call for the service provider code. What exactly, they're going to say, well, what is that code? Can you tell me exactly what I am to say as to the code that they need for 24-hour customized living?
Or over 65 or under?
Both.
So can I hang on a second here?
Yep.
So, Amy, first of all, if they call the helpline, will the helpline provide them that code?
Yes.
Okay. So that is really the answer. If they call the helpline will provide them the code so they can update their record.
Okay. Okay, thanks.
You're welcome.
Okay, we have one more question from Melissa Anderson. Actually, we still have a couple more questions. Thank you.
Yeah, so a follow-up to all of that as well. So can we assume that if we can't find that 24-hour EW provider in the support plan, or if we can't, if it's erroring out their MPI, can we assume it's because they don't have the code, or we go right to the provider and have them call the help desk, or do we need to submit the ticket and wait? And then wait for a response that from DHS or from policy that says, ooh, that is the reason. I mean, are you guys finding that that's always the case they don't have it, or is it sometimes that they just didn't get enrolled right into revision?
I think it's. Go ahead. I was going to say we're kind of seeing both, but when you go to look up the provider in revision, it should show what specialty codes they have. So if you're having a problem authorizing, 24-hour CL, and you go look up the provider, it'll show what specialty codes they have. And so that would be your cue if they don't have 24-hour 65 plus or 24-hour under 65. If they don't have either one of those codes, then that's a problem.
And kind of from a leadership level, I can't go into MMIS and look up these providers and look for the specialty codes. Like I'm looking at the provider enrollment DHS doc and it says, 24-hour CL should have, 4 different specialty codes. If I go into MMIS under the provider page and look at those, it's not I shouldn't be using that as like a clear explanation that yes, they have them or no, they don't when I'm talking about revision and if we're having issues.
So, Amy, are you saying that they can go into the search into that service and instead of typing the HCPC, type the provider and it will list the services and codes that provider has? Is that what you're saying?
Correct. Okay. And it'll show the specialty codes that they have in the MnCHOICES system, which we're hoping is the same, it's the same thing as on their provider record, but there may be small errors in between there, but yeah, if you look up the provider, look up the MPI number, you can see exactly what the revision thinks that they are able to offer based on the specialty codes.
And thank you, Melissa, for asking the clarifying kind of problem-solving question.
Thank you.
Okay, we have one more question from Krista Nielsen. Sorry, Krista, you're unmuted.
Wondering, are we going to find that some of the people that we have authorized for customized living services have been incorrectly placed with providers who maybe they shouldn't have been placed due to maybe these providers having incorrect specialty codes?
I hope that that's not happening. I mean, what I'm thinking you're going to find is that they'll have a specialty code related to customized living. It just might not be the correct one.
So then is there a way for DHS to get a mass message out to providers requesting that they make sure that their information is updated in the system rather than asking case managers to contact each and every one of them? That maybe like as it comes up and then, oh, now we can't authorize rates, and then they don't know what we're talking about and then they're upset that they can't get paid. Like, is there a way for DHS to, send something through minutes asking them to make sure that they have all their information provided and updated?
I would like to take that back for discussion with the team after today's call.
Thank you. I appreciate
that
it.
request. Yep. Beth, is it
Patricia, we
all?
are okay to move on.
Yeah, I was gonna
Yep,
say, is it
let's
all
move
right if I
forward.
move on? Okay.
Yeah.
So I'm going to provide some tips on items that we have been hearing you speak to a bit, or that we're seeing come across help desk. And then we are also, yeah, well, let's just start there. So just a reminder, when employment changes and, you've kind of like slowed down and got all your user access stuff done, if you can then put in a minute service hub ticket, and let us know that yes, this person's employment ended. It's a minute requirement, and why it matters is the system will always send an email account to the last email the person was employed by when we go to activate them for a new agency. And so the sooner we can make sure that kind of the old stuff is disconnected, it will just ensure we don't have any issues. And then that way also the other thing that you're seeing happen right now is you're adding people, you're seeing your security liaisons are seeing the security team asking back, are they employed by you or are they employed by so-and-so? Because they can see them both. And so that eventually can go away. So this isn't anything you got to do in the next 30 days, but as you kind of move forward and you can see who is active in the system, who's no longer employed by you, you might want to start sending those in as you have time, to have them removed. So just so that you're aware. And all it will do is the person's name will no longer show active, it will show blank. So they won't be removed from the system, from your list of staff members. Sorry, I need to be more clear with my language. So one of the other pieces that we're hearing is I work for 4 agencies. I work for a county and 3 MCOs. And I need access for my 4th MCO. Everyone else I have access for, but I don't have access for that one yet. What is still confusing people is that because that person already has access, they're not going to see an account created email. Instead, how they will know is they should be getting a communication from whoever did the access ticket to say, hey, your access has been provided. But they can also do a few other things. And so we'd like to just talk you through those on a way if you can see if somebody's access has been activated. So first thing you can do is if you're a supervisor, you can go to your profile. You can then click your organization link and it'll give you your staff member list. And then on your staff member list, you'll see active or it'll be blank. If it's blank, it means it's not been activated by the security team. If it shows active, you know that it has been activated. The other way you can tell it, oh, hang on. The other way that you can tell that it has been activated is that when they go to their agency login page, you know how they pick organization and then location? They will see the new organization added, and then when they pick it, they'll see the new location has been added, and that is another way that they will then also know that their access has been granted. We are looking at putting together a security liaison newsletter item that will speak a little bit more about that for lead agency security folks so that they know kind of how to check, as well as to make sure communication occurs so people know indeed what's going on. So the next thing I want to show you is a tip that we got from a mentor that I thought you would find very useful. I hear a lot of times when you're talking about working in an assessment that you wished you had more room on your screen for it and less room for all the access and navigation items. And so I'm going to talk these through and then I'm going to actually demonstrate them in MTZ, which is part of why you heard me slow down a moment, because I was trying to get my MTZ access started at the same time while talking. So to maximize your workspace for your forms, if you click F11, it will collapse some of the information And then you can use expand in the collapse caret, which is here, which also gives you more. So I think I have other screenshots in here to show you. So when you use F11, the browser header no longer displays. So you don't get the browser URL and all the stuff that goes with it. You just get this screenshot. And then if you press F11 again, it'll exit that full screen as well. And then there is a caret on the assessment on any of the forms. And if you use that caret, then it removes the person header as well. So you can remove the URL and the person header to give you a little bit more space so you can see more items. And so I'm going to try it so you can get a sense of it. So I just brought up I'm in MTZ. I'm going to first press F11. Okay, so I'm going to do that right now. I'm pressing F11. So you see the URL was removed. And now if I do the caret, I'm over here, then I have this much more space. So when I'm working in my assessment, I have much more room on my screen. So we wanted to share that with you. And then again, if I want to return so I can see the person record, I can do my caret, which shows it back up. And I'm like, oh, I need to see the browser URL again. I push F11 again and it returns. So we thought that those two were useful when you're trying to figure out how to work and see enough on your screen, that we thought that those were, it's a great tip and you would find it useful. So the other piece that I've been hearing is wanting to be able to see people in the record when the caseload tile isn't displaying someone that is on caseload because it's over 20, for example. And so if your staff want those folks to display because they have assessments coming up or other things, but they're not currently doing a bunch of work on them, you can go to the person's record and in their person dashboard, choose my task, which is what you can see right here. Here, I'll show you from Alan's standpoint. Let's go to his dashboard. You can pick my task. You can do add my task, and you could put like assessment, interview, priority high, and the date. And the reason why you could do that is then it will show up in your my tasks on your dashboard, and I'll show you that in a moment. So for some folks that you're not actively working on, but you have assessment interviews coming up or other items like that, case management, support plan visit or something, this allows you to kind of keep them on your front runner. And so in this instance, I've added for Alan Toon and Alan Me, assessment interview visits in their person record tasks. They show up in the all tasks. I can see when they are, and it allows me a way to then access them from my dashboard. So we've talked a bit about this whole person record staff assignment and multiple instances of your name before, in that if you're working for a county and then you're working as a delegate to MCO, or you're working as a contracted case management agency for several counties, you're going to see your name show up in the person record staff assignment several times. But we're also hearing from people that sometimes they're only seeing one instance of them and they can't choose. It doesn't give them the right location. And so one piece that we've learned as problem solving with other mentors is that if you're only seeing one instance of your name, in the search, type in your last name. And what we see happen is when you do that, then all of your instances, all your last name, all your names, more than one, show up so that you can then go through that, which one is the correct one by picking one, looking at the location, picking one, looking at the location. So if you're only seeing one instance of you and you know there's more than that in the system, that's my tip for today, is to search by your last name to see if you can bring up more records. I would like to next talk to you about some of the items that you've been asking about, and you say, hey, we'd like to see these in writing so that we can share them with our our staff. We've been hearing several of those in our last call, and we put some of them in today's presentation so that when the PowerPoint is posted, you would have them available for content to share with your staff members. So this one is one that we have been aware of for a while. So the parent is the guardian, and you have to pick guardian, but you would like to be able to say this person is the parent. And so the workaround for this one is to, in that contact information after you pick the parent as guardian, is to put a note that says this is the parent and the parent is guardian in that contact information. The next one that we've been hearing about is health information and the auto load. And Amy, am I remembering right that this is one of the ones that I was going to have you present on? Is it the next couple of slides?
Yes, Teresa. Yep, I can take these couple of slides. So this one we've talked about a couple times, but we do keep getting some questions about it, so we just wanted to address it again today. And so there's a couple different examples. So the first one is when the auto load of health insurance information occurs prior to the form being created, but the MALTC is saying unknown. So we're talking about that health insurance information tile that you're waiting for to be populated from MMIS. So in this instance, this example, it populates, but it says the MALTC is unknown. So the instructions in this case is that you could still make changes within the assessment form. So if you go to program-specific requirements, there is a drop-down there. As long as you waited for that to load, you can go to that drop-down and change and update the status. So there might be a couple of different reasons why it's showing as unknown. One that we know of for sure is if there's a U code. So typically if it says unknown, you'll want to just double check with the financial worker before you make any of changes in that area that Teresa's showing right now. If there isn't a U code, you confirm with the financial worker everything's good. You can change it right here. You could also let us know, because if it's coming over unknown and that's incorrect, we'll probably, we'll want to look into it and see what's going on with that data migration. But we just wanted to reiterate that just because it says unknown it shouldn't hold you up from your work, as long as you waited for it to populate.
And you don't need to create a new assessment form.
Yep, you don't need to create a new form. You can change it right within your assessment form. So that's the first one. And then if you want to go to the next one, Teresa. So this is the other scenario where you don't wait for the health insurance information to load. And sometimes that's an accident where you just, you just create the person and you create an assessment form and you forget. Or sometimes maybe it's due to, like, you need to go out and do an assessment same day in those rare instances that, that might happen, and you can't wait for it. So whatever the reason, if you created your form, you didn't wait for the health insurance information to populate, you can still, fill out your assessment, but then you'll have to close it as incomplete and then create a new assessment. You can choose to have everything copied over, and then you should be good to go. If sorry, I missed that last sentence there. Wait to the next day and verify that some of the health information is populated. Then you'll create your new assessment. So hopefully that clarifies things. I know we just had a few questions about when the status was unknown and people feeling like that was maybe holding up their work. And, like I said, you might want to, or you would want to confirm with the financial worker that their MA is good to go, but then you should be able to just go right into your assessment form and make that change and not let it, hold up your work any longer.
Yep, so really part of this is just understanding the nightly job when it loads, and then also when it does load, that it doesn't mean it has to hold up your work. So
right. Yep, exactly. Thanks, Teresa.
Mm-hmm. So the next one is about Medicare Part A and Part B, and these I understand are something that you normally use to indicate in MMIS. That you're used to using that 99, 99, 99. And so this is the description of this. And then I was going to see if it has the directions. So we added this back in because I heard you ask the question at our last webinar. And so these are the directions on what to do. So you will, when a person accesses AC or ECS in Medicare Part B, and the end date and the start date are the same as the person's start date. What it does is it says what you need to do. You need to hand correct or communicate to staff members who enter the LTC screening that you need to put in what you need to put into MMIS. And then also then note that add a message saying that they've been hand corrected in the note section for MMIS entry. Because as you are aware, MnCHOICES doesn't allow for you to enter that date that you're used to entering for MMIS. So I don't know if anyone wants to speak to this one. I will do so. I don't know if Kathy, if you feel like you would want to speak to this one or not. Otherwise, I'm happy to.
Sorry, Teresa, I thought I had unmuted myself, so I was talking, but it wasn't unmuted. I'm sorry about that.
That's
So
okay.
I'm happy to talk about this one. So in the system, right now as it stands, there's not an option for the Medicaid status when people don't need to apply for Medicaid for AC. So there's a section of people, there's a group of people that are eligible for AC, but they do not need to apply for MA. This is something that we are fixing. It's actually being prioritized now. So it's already going through our our process for being prioritized and fixed. But what is happening is on the AC chart, it is showing sometimes for people that are eligible, it will say not eligible, or it's indicating not met when it should say met for the AC eligibility. So in the AC chart, when you see that and you know that somebody is eligible for AC, and they just don't need to apply for medical assistance, you just need to go in to those that you have to hand correct the MnCHOICES assessment results to show that the person is eligible for AC. And like I said, we are, it's already being prioritized. It's already in the process to be fixed.
Yep, and the notes also note hand correct the assessment report and the assessment summary documents as well.
Yeah.
Okay, thank you, Kathy, very much.
I think I might be on for the next one too, but we'll see.
Okay, let's go. There you go.
Okay, so this is one we've had a few questions about the AC fee waiver reason. And as you can see on the slide, in MnCHOICES assessment, you are required to answer the AC fee waiver reason question before you can save the screening document. And we understand that sometimes you may not know exactly what the situation is going to be. So we're asking that you select the answer that best fits the situation. For example, if you determine that the person is eligible for AC and the AC fee will not likely be waived, like it is highlighted there, we would have you pick 05. So, like I said, we've had a few questions and we've discussed this a little bit and just wanted to let people know about it.
Thank you, Kathy.
You're welcome.
And again, we've covered this a little bit in office hours, but we wanted to make sure we did it here as well, and that it got put in the slide deck. So these are the order of the support plan statuses when the case manager or care coordinator or assessor working on PCA support plan are moving through the support plan statuses by choosing submit. So these are the statuses in order that come up. And note, just like the MnCHOICES assessment, the request clarification allows the support plan to go back to an in-progress assessment complete status. And then the other piece I wanted to note in here is that in-progress assessment complete when that status is chosen. So a support plan starts in progress. Then it gets moved when you submit to in-progress assessment complete when you know the assessment is in one of those MMIS statuses. That's when the assessment content and the COR populate in the support plan. And it's when you can begin selecting waiver providers and plans for services. So if you have staff that are saying, hey, my EW tool is blank, it is likely because the support plan isn't in progress assessment complete status, for example. And so again, this is just giving these to you in order so that you have them and so that you have them for problem solving, and that you can always, if the plan hasn't been moved to plan approved, you can always move it back to in progress assessment complete. So one of the pieces that it sounds like many of you already know is it is our tip to use HCPC code for searching when you know the service. And then I am providing you a link to the HCPC code manual so that you can have a whole list of HCPC codes to know to look up. So that's whoops, the point of this one. I just forwarded it by accident trying to grab my mouse. The next item on the agenda was we had some questions about working inside the system functionality for goals and my actions. And so what you see here is that you have this first needing to create a goal statement, then going to the my actions, and then going back to the goal to select the action item for the goal. And I don't know if we need to see that in action. Sorry, I'm trying to, whoops. I accidentally covered my screen up for a minute, so I couldn't find my support plan. So that's what you were hearing me say oops about. So in goals, you can see I don't have any goals. Oh, I wonder if I'm not, hang on. I'm logged in as a certified assessor. That won't do me any good. It was Alan that I had up. Yep, it was. So goals. So first you'll add a goal. I'm just going to put adding a goal. I'm going to fill out I'm just going to give it today's date. See once. Okay. Yeah. So Beth, because you're better at this than I, do you want to give me, it's saying add a goal statement in the target date only on the slide. So I did the target date only, and it's saying that I have to fill out the other forms.
For adding a goal, it needs to be 30 characters. So just copy what you have and paste it again so you get the 30 characters.
Okay. Thank you.
Yes, you're welcome. Maybe do it 3 times.
Sorry.
There you go.
So, okay, so I just filled out those basic pieces. Then I'm going to the supports I requested, correct? Is that, sorry, I don't have it. I have to grab it. Okay, then I'm going to target my action.
You are
items.
in a support plan that is not for disability waivers.
Okay. So anyway, so we'll go back to this since I don't have the right one up unless Beth wants to bring one up, or if she wants me to bring one up. So then you would put in the my action items next, because it would show up over here. Fill it out, then go back to the goal. And then you would then put, you would choose it in the, you would choose the action in here. So sorry, I feel like this was way clunky because I didn't have the right one up. Do you have one you want me to use, Beth?
I am pulling it up really quick to see if I have something that is appropriate.
Thank you. I just feel like otherwise I'm clunking around and they're not seeing a good example.
Yeah. I just want to double check. I think that we did this on Friday. Yeah. Do you want to pull up Pippin? And then the support plan that the DD support plan is.
Oh, hang on, I did staff.
Has a goal there.
Okay.
There you go.
So in this instance, so should we just add another goal for Pippin so we can see how this works?
Or you can edit the goal that's there too.
We just won't be able to walk through the steps that we asked them to go to. So if I just
yeah, you can
create
add another
something
goal.
that we then delete.
Go right ahead.
I am adding
Don't worry about deleting
another
it.
goal that is 30 characters. So what we said in the notes is add goal statement and the target date only. So I'm just going to put the date out till October and we're going to hit save. It allows it to save. And you can go to my action items, add an action step, adding an action step. Just do the same thing for here. Then it says to go back to the goals. Someone's got to wait for my little whirly dude to be done. Then I can go back to the goal and edit it. And then I can select an action item. So I could add this to it. Put it over. Oops, hang on, I don't want to do it for this one. Cancel. I picked the wrong one. And it will add it. So I know there was some question about workflow, and so that was the point of this, is to show you and to provide you instructions on how to go about doing it. And then Amy Rumsa, this one has come up before and we said that we would get it in writing instead of only having it verbally. And I'm wondering if you could talk to the 24-hour CL, please. This first page is the description, the second page is the directions, so you know.
Okay, so yeah, we're aware that for some rate plans, the 24-hour CL calculation is not working correctly. And I've narrowed it down to, it's usually if somebody has either behavior or orientation support needs, those are automatically supposed to qualify somebody for 24-hour CL. That's where I think things are broken here. Or people either get an error saying the person isn't eligible for 24-hour customized living when they are. And then the second thing that people are seeing is that you need to add 50 hours of service. So the two things are related because basically in calculating 24-hour CL, there's all kinds of different ways. 7 different ways actually. And if the person doesn't qualify through the first 6, then they're going to say, okay, here's your last option, and that is to include there's certain personal care things that have to be met, medication management has to be met. So it's a whole bunch of different factors that have to come together for them to become eligible. So if the system isn't recognizing that the person is eligible based on their orientation or behavioral support needs, it's going to try to have you qualify the other way. And so it's going to want you to have 50 hours of service. So that's an error. And the workaround is just to choose regular customized living. So and basically that's the only thing that you'll do differently. You'll do your tool the same. The one additional step is you have to check the summiting device box. When you choose the service of 24-hour CL, that's automatically checked. It is not that way in the regular customized living tool because that's something that isn't required from a non-24-hour provider. Make sure when you're doing that you have the most up-to-date rate sheet so you can see what the 24-hour CL limit is, and you can plan up to that limit. When you get to the end of your tool and you get a rate, it's going to tell you that it's over the limit, and that's fine. You can go ahead, go forward. It's not going to stop you from saving your rate or anything like that.
Thank you, Amy.
Uh-huh.
I know this is something people wanted to see written down, so thanks very much. So that is kind of the end of the providing you guys some tips, and I don't have any other slides to present, so we want to leave the rest of the time for questions. And so Beth, go ahead, and if you could please remember one question, then get yourself back in line, because I just want to make sure everyone gets a chance to ask questions today. So thank you for respecting that.
Okay, Molly Hodge. Your hand's been up for a while. Are you there, Molly?
Oh, yep, I'm here. Thank you. Can you hear me?
Yep.
Yep.
Okay. We have a user who has not been able to log in at all. However, when I search her, we have 4 organizations, locations for our county. She is active with all 4, but she has not received that email with her password to log in. How do we get that for her?
So couple things. Before you submit in, make sure all of her email is marked primary. And if it's not, will you go ahead and mark it primary?
Okay.
I'll show you what that looks like first of all. So see here on email that it is marked primary.
Mm-hmm.
So for all 4 of those counts, make sure it's marked primary. You're probably working as a delegate. Some of those are delegate. So I'm sorry, I'm thinking about the user access ticket. You would have the security liaison for that lead agency submit an access ticket and specifically choose resend account verification email. Okay. And you only need to pick one of them to send it because that person is activated. Once they kind of log in and do the steps that's in the email, then all of the organizations should display in their organization drop-down menu when they do their agency login. So pick one that's, and go ahead and then, like I said, in the minute ticket, Service Hub ticket, if you put account verification email to resend that, there's an option to pick that, then they'll resend it for you.
Okay, thank you.
Okay. Yep, you're welcome.
Okay, Kristen Rhodes.
Good morning, everyone. Teresa, my question goes back, or statement, I guess, maybe even goes back to slide number 32, where the instruction is to, go into, as if you're working as an administrator or whoever in the system, and go into your own organization and then select the org and then select staff Going back to July or since July, and I just double checked it today. Well, we were going through some of those other areas. There are quite a few. I have probably at least 20 on my list, and we have some other people in our other counties too that just don't show up in that list. However, they do if you go to the main
And do
page
a
of
search.
select staff. So yeah, so I just wanted to potentially even give some clarification, and maybe there needs to be that extra piece written in somewhere for others. I don't think it's hindered anything. I haven't heard that from many of our workers, but it's just one of those things. If that's the only item that it tells you to look through, then people might be submitting tickets. I think way back when I submitted a ticket or an email saying, hey, what's going on with this? I was able to just kind of troubleshoot my way through it.
Right. So to your point, which is, thank you very much for being very kind. So what you're saying is I'm giving you another problem solving option, mentors. And so what you're saying is if you can't find them in your organization staff member list, it doesn't mean they're not there. Feel free to go up onto the person search, put the person's name in, and they'll come up in the search, and you'll be able to see if their status is blank or active. And I'm in MTZ, so I picked someone that we've created for demo that you can see this person's not active because it doesn't say active here. So to your point, you're saying, okay, if you can't find it in the staff list, you'll probably find it in the staff search, which is what this little box is. It's the staff members.
Yep. So just making sure to switch that because sometimes that gets forgotten.
Yeah, the system automatically puts it to person, and then you're
Yeah.
like, oh, I can't find the person, and you're like, oh, I didn't choose staff member. Yeah,
And I
thank you
guess
very much.
the only question I would pose with that is just that I don't know if because they're not listed under organization somehow, some way, glitch, whatever, if that would ultimately affect any of the like reporting queries or various things like that. So
I am not aware of it affecting anything. That staff member list, you can sort it, A to Z, Z to A, and then it sorts back to nothing. So when you click it 3 times, right? Here, I'll show you. It just is what it is, but I am not aware of a person in that staff record not showing up, meaning anything. If you can search for them and find them, they exist. But I was just I made an offhand comment, so I wanted to make sure I talked about it. So when it first comes up, it's it may not be in any order. It may be A's and then J's and then P's and, and it's not in first name or in last name. So you can literally sort it. And it'll first do it alphabetical, A to Z, then I think it does it Z to A, and then it just mixes it up. So, and sometimes this is just a really long way to look at it because like you can see, I've got 20 pages in here and this is going to take me a really long time to do it. So to your point then, searching by staff member is most useful.
Thank you.
Yep, you're welcome.
Okay, our next question is from Lane Magnuson.
Morning, Lane.
Can you hear me?
Yep, just fine. Thank you.
Okay. I just have a question about the assessment. So I am not finding any place to do a signature in the assessment. Am I correct? As far as I know, it's just in the support plan.
You are correct.
So it's just a little confusing to me because I'm used to having them sign the 2727 when I do an assessment. And there's
you should continue that. Use the 2727.
So we take the paper copy of the 2727 out with us and have them sign the paper copy and just attach it.
Correct.
Beth, do we want to show them for when they're looking for guidance on what papers to bring with them, where to find it in CBSM?
Do you want to show the form page? Is that what you're?
That's what I'm thinking. So you know how it is. You guys are working along and you're getting to the places where now you're asking these questions and they make more sense to you. So if I remember right, isn't it in here in that CBSM page where you've updated it so they know what forms to take out with them?
That is correct.
So then you'll see used with MnCHOICES, and so you'll see if yes, you need to have it signed or not. Take it out with you. So the 2727 should be in here somewhere. I'm not
The
going to
top one.
Okay, thank you.
There's that first thing you showed. Yep.
So as you're new and using this, this is a good place to go back and see. So what forms are required now that I'm in the system?
Thank you.
Yep, you're welcome.
Okay, Emily Gerard.
My question is about the goal section. Thank you for the walkthrough.
Yep.
The more we do it, we're getting there. My question is about the 30 characters being a requirement for the goal statement. Is that a requirement? I know that's a requirement currently. Is that a system functionality issue? Is that something that DHS would have control over changing? It doesn't feel super person-centered. We have always trained our staff that in an ideal world, we would get a direct quote from the individual that we support and list that as their goal in their own words. And sometimes our folks are nice and concise. And so I'm wondering where that 30 character limit comes from.
You can take that back, Emily.
Okay.
Thanks.
Okay, that's the only question about goals then. Thanks.
Okay, thank you. Okay, I don't have, it's just Melissa. I don't have a last name for Melissa, but Melissa, you are unmuted.
Good morning. So we have a case manager that is creating a support plan in production, and this client is receiving strictly consumer support grant or CSG as their service. And with the CFSS language that's in the support plan right now, when she goes in to enter a service and running a rate, she's not able to, or we're not able to search for that service based on the HCPC code. I know that the recommendation was to use the search for HCPC code, which we did, which should be T2025 for CSG. We're not finding it under that, and we're not sure exactly how else to proceed when this client is just CSG.
So for CSG, you'll need, we do have a workaround for you. If you want to send it in, we can help you with that, but you're basically creating a program type with CFSS, a CFSS program type, and you're entering in the information into people and organizations that support me for CSG, and then you're able to get your Type B service authorization, so you're able to enter that in for
Does that
CSG.
does that make sense? Do I need?
Yep, no, that was something that we kind of figured might be the answer, because that way we don't have to actually run a rate. It doesn't go through that.
Right, yeah.
Okay.
It's people and organizations that support me. It's the timing with CFSS, you know, we're still trying to work through that. So it's just a hiccup for the interim until CFSS is off and going, running. And
Okay,
CSD
thank you.
is no longer available.
Thank you.
Oh, it's back to me. Let's see. Katie Benson.
I have a couple of questions regarding printing. The first being that I'm having trouble almost every time I'm trying to print either an assessment or a support plan, that it gives me an unauthorized error message. It seems to work if I clear the cache, then I go back in, that it will sometimes print, but is that a known issue?
It is.
It's a known issue.
And Heather, do you want to respond back to that one on what the workaround is? I just want to make sure I have it right. I think it's to use the refresh.
Can you repeat the question?
Sure. Could you say it again, please?
I'm having trouble printing most documents. It's giving me an unauthorized message.
Yeah. Yep. So right where you were going, Teresa, the refresh button at the top of the browser there. Yep. You'll want to close out of your form that you're trying to print and then hit that refresh button. And then go back into the form and try to print again.
Okay. And then my second question regarding documents that we are sending to the person. Is there, which document would you recommend that has the most detail? And maybe it's more for my own use, but I'm finding that the assessment summary that we mail to the person has very little information about their needs listed there. It just says, you know, general areas that the person has needs in, such as communication. But is there a document with more details for my own use about the person's needs?
I would use a supplemental summary chart.
That's
You
where I
could
was going.
check there. That has a lot of detail about the person's needs, the areas where they were considered dependent in
Okay.
TCA on the LTCC screening doc, any behaviors that they might have. It gives you kind of a quick summary.
And the
Okay.
reason why I can't go there is because I'm in case management as a role. But if you go in here, yeah, it will give you the narratives too in that supplemental summary chart.
So all the narratives that I would have entered into the assessment would show in that chart.
Am I remembering that right? That's what I remember.
I'm not sure what, I think that it's all, but
It's a bunch
a
of them.
great deal of them are.
Yeah.
Yeah, I would print it out and take a look at it. I think you'll find it helpful for what you're describing for us.
Okay, thank
Teresa,
you.
this is Amy. It does include, well, it looks like you're pulling it up now, but it does include the narrative summaries. So it says supplemental summary chart. So it's multiple charts, and the first chart shows narrative summaries from each of the narrative areas.
Yep, that's what I was remembering as well. Thanks, Amy. Next question, Beth.
Our next question is from Madonna Cormier. Oh, Madonna shook her hand down. Linnea Stevens. Linnea took her hand down as well. Kim Perkle.
Thank you. Question I have is, when our security liaisons submit for onboarding access, and this is referring to that active status, Teresa, that you were referring to?
Yep.
How long does it take for the system to show that active status?
As soon as they activate the account, it should switch over. Is how I would respond to it. It should be as soon as it occurs.
This is Heather.
Heather was saying the same thing.
Yeah, as soon as we activated it, it switches over.
Okay. Because we
Are
have
you
some
having-
that we've gotten emails. We're tracking some of our issues, and we are receiving emails back that the DHS SAM team has activated them and sent those emails out for the, for the access, but yet they're not showing active. So we have some issues there. That's why I was curious. So we're trying to troubleshoot that.
Yeah, it could be a couple things. You could have more than one instance when you're looking at it, where you're seeing them a few times, and there's one that is active and the rest aren't. So you might be seeing that. I'm trying to think what else you might be seeing. Tip I'd always give you is before you ask for that account reset verification email to go out is to always make sure the people that you put in that request for all have their email marked primary, just to make sure that it doesn't send note to nowhere, because if it's not marked primary, it won't send it to them directly. So if you are still having the issue and you haven't verified that, yep, the ticket's been complete, put in a help desk form and put in the people that you're seeing it for, and we'll look at it.
Okay. Super. We'll do that.
You're
Thank you very much.
Yep.
Teresa, I was going to add one more thing.
Sure.
If you're not seeing that they're showing active. As long as you don't have any forms offline, you could clear your cache and go back in and see if that updates it. There might be some lag there happening. So try that as well.
That's a good idea. Yep.
Sure, we'll do that as well. Thank you very much.
Okay.
Okay, our next question is from Leah McDowell.
Good morning, Leah.
Good morning. I have a question on slide 48, the AC fee waiver reason. And what I heard was if you're not sure about which option to choose. But I think mostly assessors are sure that the fee, whether the person has a fee or it's waived. And so I'm wondering, like, if we know the person has a fee or they're at an annual assessment and they've been paying a fee and we know they will continue to pay the fee, what should we put in there? Like, if we have to choose that the fee is waived, is that going to create an error with like getting a service agreement approved? Because this is required to put an AC fee waiver reason in initial and annual assessment, whether or not the person has a fee currently or doesn't. But when we know they have a fee,
which choice do you make?
Yeah, because none of them apply. They don't have the fee waived. But if we put a fee waiver reason, then we're sending an assessment to a case manager with like wrong information. And then are we putting this wrong information into MMIS or are we putting the right information into MMIS?
Are you hand correcting it? Yeah.
Yeah.
Yep. Good question.
This is Kathy, Teresa. I think we'll have to take this back. And just to clarify, you're saying it's not for an initial assessment, but for
both initial and annual assessments are required to put an AC fee waiver reason. And currently with MnCHOICES 1.0 and in MMIS, this field is not required if the person has a fee. So if they have a fee, we're not saying it's waived.
Right.
This is only if they meet the criteria to have the AC fee waived. So if they don't meet a waiver criteria, we need it to be blank. Revision requires an answer, which will be wrong. Do we put the wrong answer into MMIS? Or how is that, like what should we do?
I think what I'll do, I can take back your question. We'll have to get back to you about that.
Kathy, do you want her to submit it into a help desk form so that you have the person who to get back in contact with?
I actually did. I did send it in, and I sent this follow-up a few weeks ago. I just haven't heard back.
Okay.
Okay.
I
can
sent
check
another
into that, Leah,
ticket.
because I thought I had responded to you. So let me look. But I can look. If I have not responded, maybe you do want to send in another one, but I believe that I did respond to this.
Okay, I'll respond to my email too, just to make sure. Thank you.
I think part of the 05 says that, I'm sorry, Teresa, I'm going to try to bump it up on my bigger screen, but I think the person is found eligible for AC, but is not receiving AC yet. So I'm thinking that might be applicable for somebody who's just for the initial assessment. But I think what I hear Leah asking is on a reassessment, what they would put if the person's already on AC.
Correct.
And Leah, I'll look in my tickets too.
Thank you, Kathy. Thank you, Leah.
Okay, our next question is from Kelsey Peters.
Morning, Kelsey.
Hello. Hey, I'm wondering if you can help us or help remind us. I think you've talked about it before, so I apologize. How to add housing stabilization to a disability waiver plan, support plan.
That is a great question. Can we do a little research really quick and see if we can get back to you? Well, we don't have Jan on the call with us today. We'll do a little research and see if we can get back to you with an answer.
Oh, okay. Sounds good. Thank you.
Okay, thank you. Okay, Trista Holbeth.
About adding people to MnCHOICES. I'm a MCO delegate, so all of our members that we work with are not known to MnCHOICES. So we're going through and adding people, but we came across a person who isn't found when MnCHOICES searches for MMIS matches. So pretty much everyone else we've added, we import after they find that person as a MMIS match, but this person, it says no matches, but they are known to MMIS and are active on MA in MMIS. So just wasn't sure what we do for this particular scenario. If we create the person anyways, just didn't want to create a duplicate potentially.
I'm just taking a moment to let policy talk to each other about how they want to proceed with answering the question.
Okay. So far it's just one, but.
So do they have a PMI then?
Yes, they have. We searched PMI and social, but it says no matches found when we do the potential MMIS match step.
Yep, I think I know the answer, Amy,
Yeah,
but
I'm
go
wondering.
ahead.
Yeah, I'm wondering. You're probably thinking the same thing I am. I'm wondering if it's just that clearing period, that it just hasn't cleared to Swindex yet, so they were added maybe pretty recently, or their PMI was created pretty recently. So as long as you're confirming and you're like super careful when you type in the PMI and confirming everything's correct, you can go ahead and add them into MnCHOICES. Yep. And then as soon as that clearing happens, there's like a schedule that everything clears from MMIS and everything else into Swindex. Everything that the system has will come over and populate into their profile. If there's extra additional things that need to populate, it'll come over. It'll find them. So you're okay to add them. I know it's like sounds a little scary to add them, but you are okay to add them.
Okay, so even if the person's been on Medicaid for years, still do the create person and it will somehow sync up.
Yep.
Okay.
Yeah, because I mean, most of the time you'll be finding them, right? When you'll start create person and you get to MMIS and there they are, and you'll just say, yep, import that one. But for the ones that aren't, it's likely that like Amy said, there's a clearing process that the databases go through. And as long as you know the PMI, you can create the person and very carefully put the PMI in and go ahead and create the person. And then when that clearing updates, then it'll pull the data into MnCHOICES. And so we have no control over that timing. That timing is not set by us. So that's the best way to do it.
Okay, thank you.
Yep, you're welcome.
Okay, Heather Schmall.
About like the sensory concerns that we're seeing and where in MnCHOICES we would put those. The old MnCHOICES had a really robust sensory concern area, and I'm just not finding it in the new MnCHOICES and where we would put those concerns and know what kind of questions to ask for what sort of supports are needed.
Sorry, I'm thinking of your question in regards to assessment. I think that you could do that throughout the assessment. of specific sensory needs. We do address things like fine motor skills. You know, the well-being section will probably be the best place to address that, and you could address it within the narrative if you're not finding specific the specific questions you're looking for about sensory, about a person's sensory needs.
I guess my concern is more so like new assessors not having known that section in the old system and not knowing kind of what questions and sensory related things to talk about. That gives a lot of, you know, kind of guidance on those kiddos and what to, you know, recommend for them and how family support grant can be used. And it feels like a missing piece that is really important, especially for our autism kiddos.
Okay, we can take that back and make sure that we have, that we're looking at that for our guidance, so that the training that we have for our assessors is, make sure that we're touching on that.
Mm-hmm.
Thank you. Okay, Emily Gerard.
Hi again.
Hello.
I am not sure if we'll have time now or if it's maybe a future webinar topic, but so we do waiver case management. We're working on some support plans, thinking about the signature section. Is the intention to be using the MnCHOICES revision signature section even for provider signature? Should we still be using the EDOC form for now? There's not a ton of detail, or maybe I forgot about it because it's been a minute since I've redone the TrainLink trainings, but about really walking staff through how to navigate through provider signatures, second attempts, things like that. And there seems to be a lot built into MnCHOICES, but it's not necessarily super print friendly. And we don't really have providers at the visit to do an electronic signature.
So does the practice guide document for support plan speak to signatures in the way she's asking questions? Does that provide that?
Hi, Teresa. This is Victoria, and I can answer
Victoria.
that question. We are developing a signature standalone sheet while we are working out the kinks and the electronic signature within the application. When possible, we would recommend you using the signature within the application. And if that's not feasible when it comes to providers, you guys are still allowed to use the 6791D until we come out with this other form that we will be coming out with very soon. So that is the direction that we have at this point in regards to signatures. And then when you get that signature, you can upload it within the person's signature section of their support plan.
Only if it's open though, right? So we would leave the support plan open while we're working on signatures from providers?
Correct.
Okay. So we would wait until we've done both attempts, or if we get it after the first attempt so that we can load it in there.
Correct.
And then, okay, so we wouldn't close it till after both. Sorry, just processing in my head a little bit.
Yep.
Okay, so we would leave it open for a little while longer than we're maybe used to in the current system. So we can load them in there.
That would be best, yes.
Okay. That helps. I do also have one question, or maybe just a small piece of feedback about printing as well with as case managers, when we get the assessment summary in the print version, there's a very large created date that prints at the top of the page, and that is not the assessment date. The actual assessment date is significantly smaller in the middle of a sentence, a couple of rows down on the page, and it's causing some confusion for case managers about when do they need to make sure their support plan is done by. And I'm wondering if there's even a reason to print the created date in the printout. Like, does that really matter for printing reasons? And could that either be removed or the size of it changed so that the date of the assessment is the larger, more noticeable date?
So what we hear you asking for is an enhancement to the printing functionality And
Yeah,
we
that
could,
sounds nice.
yeah, and we could take that back.
It's a very fancy way to say it. I like it.
Isn't
Yeah,
it?
just that created date is very large at the top. It's where your eye is drawn, and I'm not even sure why it would be needed, I guess. And then the actual assessment date is quite small, buried a little bit, a couple lines down.
Teresa, this is Amy. I was just going to mention we have had this reported in, and we do have it. Are considering it for a future enhancement. So we've gone through our process to get it in the queue. So just wanted to mention that.
Awesome.
Thank you, Amy.
Thanks, everybody.
Okay, the next person we have is Amy.
Hi, can you hear me?
We can.
Yep.
Hi. Say, I am just trying to work through the current functionality document for when the system does not allow an eating score of 02 when the person has higher needs in meal prep. If I can't get that to work, is that one supposed to be manually corrected on the screening document, or should it populate for me when I follow the document?
It should populate for you when you're following the document. Are you choosing that the person needs assistance with special arrangement on the under meal prep?
Yes, I have that noted.
And that they need, they're having either a 00 or an 01 in eating.
Yep. So I have the
Okay, yeah,
instructions noted so that they can feed themselves independently, and then per the document, I have it coded that they need that special prep from another person. And it's still showing as 00.
Yeah, did you go through this? And I'm sorry that we keep asking this of all of you. Are probably like, but make sure that you go through after you make those changes that you're running the rules. So do the assessment results and then go and save that screening document. You have to go to the LTC screening document and save it in order for anything to update when you're printing. And so make sure to go through those steps first. And if it still isn't working, let us know and I'll dig deeper into it. Or we'll dig deeper into it.
Okay, so I have to actually, because I did pull it up as a print document. I didn't save it.
Yep, you can't do the print until you save it. You have to go down. Teresa, I don't know if you want to show an assessment really quick just to walk through this, because we're seeing lots of questions like this, and we keep saying back to you to do this, and then when you do it, it works. And so, yep, in the right nav, go all the way down to, so the first, you want to do assessment results first, which Teresa won't be able to do here because she's just viewing. So you'll run, so if you click assessment results there, Teresa, you'll want to hit get results, but don't hit get results because it's not going to let you do it. And then go down to the screening document in the right nav, the right navigation. And then if she had a screening document in here, you would have to, it would be here and you'd hit save. And once you hit save here, it will work for you to be able to print your document and update your scores. If you don't hit save here, it will not update your scores.
Because basically what it's doing is, yeah, because what I hear you saying, Beth, basically is when they do get results, then they come here and hit save. It's pulling the updated results.
Correct, correct. If you print before you do this, it's going to give you results that are inaccurate.
Okay.
Because you're not saving the screening document. You're not telling it to update the screening document print. So this is the rule that makes your print work.
Okay, so not just clicking get results is not enough. You have to go there and click save.
Yep.
Yes.
Sounds good.
Go to the screening document and click save. Yeah, thank you. Okay, Katie Pinkert.
Can you hear me?
We can.
Okay. Just a question about best practice with the caseload. So your dashboard, you can only see like 1 or 2 people on your caseload. Is that supposed to be, because like a lot of us have 40 to 60 people, is that supposed to be everyone all of the time?
You should be able to see the 20 that you are working on.
Right, but I mean, it's very small. You can't expand it at all. So
You can
are you supposed
scroll
to
it and you
unassign
can
yourself each time, or are you supposed to keep them assigned to you for the entire year?
So First of all, so for your caseload, you can search. If they're not all there, of course, you search them up here. Your question about workflow and when you are done with an assessment, do you unassign them from an assessor? I believe that that would be whatever your normal protocol is for your agency, but policy, feel free to chime in because I want to make sure I'm correct.
Just, I think that's been up to lead agency policy.
Right. That's where I was going.
What
So, yeah.
Is there a way to make that like the My Task where it's a larger box or tile?
You can move them around.
It won't get any bigger though.
Yeah, so then no, there isn't a way.
Okay.
All right, we can put that in as a future enhancement though, if you want to send it in.
Okay.
That's something we can consider for the future.
Yeah, it doesn't even make it bigger if you take the one below it out. I was just gonna try it and see.
Okay, Lane.
Hi, it's Lane again.
Hi, Lane.
So I just have a question about the how the support staff know to proceed with the MMIS entry, because some of the directions I see, if it says okay, MnCHOICES assessment completed, ready for MMIS, that if they're an assigned staff, that they will get some kind of message. The only way we've seen that work is if we send that person a task and then they send a task back to the case manager or assessor.
Yeah, so currently notifications are turned off, but if you didn't want to do task, which I think is a grand solution, is you could also message inside the system. So you could, use the messages and message that staff member because you'll know their name. So you can go into the inbox and send it that way and let them know.
But right now we have to let them know somehow besides.
Yeah.
Okay.
Yeah, no, notifications are currently not turned on. Correct.
Oh, okay. That's
I'm
good
sorry
to know.
if
And
if you hadn't heard that before, but yes, that is the case.
I probably did. But so, and it just makes it easier for our support staff to track that if they get a task and then they can be done with that task.
Yeah, no, I think that's a great workflow.
Okay. And then should the support staff have all the people in their caseload? I mean, we're trying to work through that too, and maybe that's an agency thing we have to decide.
I think it is an agency thing.
Okay.
How you want to do that.
Perfect. Thank you.
Yeah.
Okay, Martha.
On the 2727, did I hear correctly that annually, and every time that's signed, that needs to be attached in revisions?
Yes. Yes, so when you do the 2727, it is an annual form. You do it with every assessment. You should attach it to as an attachment to the person record. Just a copy of it to the person record.
Okay. All right. Thank you.
Thanks, Martha. Okay, Kelly Hughes.
I had a question on a closed support plan. If the way that we revise a closed support plan, has that changed? I see it like in the ellipsis that there you can open the record, but they used to have the revise function there, but that is no longer there. I was wondering if anything has changed with that, or how do we revise?
Does anyone have a support plan that's in closed status? I was going to see if I have.
Are you using a Tornado to search for support plan to get the revised status?
So that's what she means by this, the filter?
Yes.
So
yes, the filter. We call it the Tornado. Teresa, do you want to just click on an ellipse? Well, you have to see.
I don't have one. I was trying to see if you have one that's closed. Does anybody got one that's closed?
Lisa, you can
Yes.
go on, use the last name Ingalls.
Okay, thank you.
They're kind of messy because I do a lot of testing in there, but there might be a closed one in either Carolyn or Charles Ingalls.
Okay, let's go look at Charles.
I don't have my system
plan.
up right now.
So here's a plan approved. So you open the record.
First, I think first you have to go over to the tornado, right?
Yeah, hang on, I did, but I'm in certified assessor, so I have to change my role. Sorry. Like it's not gonna show it to me no matter what. So I'll start over. We'll do Ingalls. We'll pick Charles. We'll pick forms. And we'll go to the tornado and we'll pick support plan. And here's his plan approved support plan. There's revise.
Okay, so we have to remember to use that filter first.
So Kelly, is your question what happens if you use open?
Well, when you open the record, it just goes into the assessment, and then it doesn't give you the option to revise it. So I just
It doesn't.
So you have to use that tornado in order to search for the support plan, and then you'll get that revised under the ellipsis.
Yeah, what this filter does is it only provides you the support plans, which then allows the ellipsis to display revise.
Okay.
So it allows for that functionality to display is how I would talk about it.
Okay.
Mm-hmm.
Thank you.
Yep, you're welcome.
Okay, Linnea? Linnea, I unmuted you. We are still having trouble hearing you though.
I'm wondering if she's double
We're
muted.
She's having some technical difficulties. I'm gonna go on to Madonna.
Okay.
Hi, Madonna.
Hi.
Madonna.
Hi. Teresa, could you go back to slide 53?
I will flop it over and go down to 53. Sorry, my mouse is having a heck of a time today on this. So I'm gonna have to just do this. I don't know why. Okay, there you go.
Okay. So I believe Amy said that the workaround for the 24-hour customized living is to choose regular customized living.
Mm-hmm.
Okay. So I am working with an assessor, and we confirmed that the provider does have the specialty codes for customized living and 24-hour customized living. So when we went in to enter the 24-hour customized living HCPC code, the T23 or the T2031TG, and we were not able to find the 24-hour customized living. So we used the customized living HCPC code, the T2031, and we were still not able to find that service. So what do we do?
So did you try searching by the words customized living?
Yes.
Okay. Do you want to send in a ticket? Because I would definitely need to find out what's wrong.
I sent it in yesterday.
Okay. Yeah, and I've got a lot of tickets regarding the tool, as you guys can imagine, based on all the questions today. So, but I'm gonna try my best to get them all out within like a 24-hour period.
Yep. Oh no, I'm sure you're inundated.
Thank you, Madonna.
Okay, Heather.
I didn't mean to, sorry.
Okay, Melissa Hutchins.
Previously, I guess we were under the impression that we were only supposed to attach, the only required attachment to person was the MnCHOICES worksheet and any edited documents. And today I heard that we should also be attaching the LTSS signature page. So I'd like it written up or clarified. What is the expectation for what we are supposed to be attaching to person?
Okay, thank you. We'll take that back. Okay, Anne Henningsen.
I am hoping that you can tell me what form I need to send to my PCA providers. In the original MnCHOICES, it was a PCA summary, but I don't see that in the revised MnCHOICES.
You are going to sign the supplemental summary chart from the assessment and the CSSP with additional information and support instructions for the provider.
Okay, can you repeat that one more time?
Yep, supplemental summary chart. And I'm sorry, I called it a CSSP. Oh, guys, it's your support plan. You're going to send a copy of the support plan with support instructions.
Oh, okay, that makes sense.
My mistake. Yep, sorry.
All right, thank you very much.
Thank you. Amy? Hi, Amy, you're unmuted.
This is our last question.
Okay.
I'm gonna go ahead and do the final pieces before we end the call because we're at 11:59 on my clock. So, you heard me today say that the PowerPoint is on the Disability Services Division website on the webinar training archive page. And so when you get there, it will look like this. You will click on MnCHOICES, and then it will have all the webinars for the most recent on the top to all the other webinars and office hours and everything listed below. The PDFs and the recordings are both there. You should anticipate that that you'll see this PDF the end of next week. And if it is not there, please wait patiently. It is our team who wanted to make sure we had all the content in that you've been asking about in before we submitted it into the TTC team, which made it a little bit late. So please be patient on the posting on it, but that's where this PowerPoint will be. I want to say thank you to all of you. These launch webinars have been important for all of us. They've helped get us all on the same page, and it is most appreciated. And please know we really do appreciate each and every one of you, the questions that you ask, as well as your working with each other to give each other tips and tools. I've appreciated that very much today. It's been fun to listen to you each give each other pointers that might be useful. So again, thank you all of you. And we will for sure talk to some of you at the next MnCHOICES office hour. So have a great rest of your day, and we will speak with you again soon.